go ahead. So we just finished treating Paul, and curious to see how he responds. So come on back, walk back and forth a couple of times.
Wow.
Your thoughts?
Let me try something here.
Sitting's gonna be the trick, right? Aha.
I couldn't do that before.
Is that right?
Yeah. Wow. That's why I was using that strap.
Yeah, could you show us that strap?
Yeah.
That would be very informative.
So I could not put the sock on with this. Remember how I did it on the table over here?
Yep.
So this is what I was using it for, to lift the leg up like that.
Uh-huh.
And I've not been able to do that in months.
Wow. So do it one more time, please, without the strap. Outstanding.
Yeah, I could not do that with, there's just no way.
Beautiful.
There is no way I could do that.
Nice. What did it feel like walking?
Felt good. Now, the only thing I'm scared about is letting my foot down.
Yeah. Oh, yeah. No, that's a given. Yeah.
I could not do this.
Sure.
That's why the strap,
You bet.
I just used the strap.
Now, sitting was also uncomfortable.
Yeah.
So do you want to just sit for a little while and see what that feels like?
Yeah.
Would you be able to go sit to stand now, or would you have to wait a while?
What do you mean? Let me just sit like this for a minute.
Yeah. My impression is that we're on the right track.
I'm shocked that I could pick my leg up.
Yeah. Now, it's a given that, you know, when we watch you walk now, you're walking a lot better. The knee is still stiff. It's still, you know, different. You're not walking like perfectly normal. You can see that the right knee is somewhat stiff. But you're definitely not swaying to the side with your upper body as much as you were before. So I think that we are onto something, and I think that we can make a big difference. This 5 minutes later of applied force.
I'm shocked that I can lift my leg up. Shocked. Shocked.
So try standing. Would that have been difficult before?
It's probably a little bit too soon, but you know, I notice I'm kind of bending my knee a little bit more when I walk.
Nice, nice.
And I'm barefoot, which I never walk barefoot.
Is that right?
Yeah. 'Cause
Good.
I feel like,
Very good. Come on back.
wow.
So I'll stop filming, and we can go sit down for 3 minutes or so, and then have you go sit to stand.
I
and
almost want to see if I can kneel on the ground.
do it. Go for it.
You don't think it'll be too much pressure on my knee?
You'll know it. You'll have something to hang on to, so you can come back up if you need to.
That hurts. But I couldn't have done that before.
Right.
Even gotten down like that.
Uh-huh. So just to summarize, I'm going to keep filming this while I run to the other room and grab a knee model. So I will be right back.
Okay.
And show you what I was speaking of. So you are the second case I've seen in 3 weeks. This is a knee model. So this is the knee joint. So this is the this is the bottom of the thigh, and this is the lower leg, and you can see the meniscus in there. And so what I was suggesting was that for unknown reasons, the bottom of the femur was stuck posteriorly towards the floor, beyond what was normal. And the treatment that I did was I blocked movement on the other side, and I glided that tibia forward and into slight external rotation. So I think the camera drifted a bit. So I'm suggesting that his distal femur was stuck posteriorly. It was actually hyperextended. And the treatment involved blocking movement at the tibia and gliding the femur forward for 5 minutes with a little bit of external rotation, outward rotation. And I've seen 2 patterns like this in 3 weeks, and I don't see a lot of clients. I think it's a very important one. I don't think it's on everybody's radar that's treating knees. And it can be a big piece of the puzzle. There's still other issues going on that one wants to address, but it's certainly a big enough player given the response that we had in a very short period of time. So anything else you want to say before I stop filming?
This is just amazing. That I can sit here and do this. I couldn't do it before. And lifting the leg up to put my socks on.
And what can you do now that you couldn't?
I can lift my leg up to put my socks on.
Yeah, nice.
Like that.
Yep.
I can actually sit with it like this for a minute too, it's not killing me.
Uh-huh.
I feel a little bit of I'm pulling something right here, like on that thing that you showed us.
Yep.
It feels like I'm stretching something out right here, because I haven't done this forever.
Sure. Very good.
Yeah.
Well, I'm going to stop filming. We'll go sit down for a few minutes and see if your ability to go sit to stand is different. So I'll stop right now. Thanks.